The second wave of coronavirus cases that's now hitting much of the world means that many more people will be working from home a great deal longer than they first thought. Microsoft, for instance, has just told some employees that they can work at home forever, which is the biggest company so far to make the announcement. Ford and the retailer Target have told staff remote working will continue until June 2021. Dr. Margaret Hamburg is with me, the former FDA commissioner under President Obama, joins me from Washington via Skype. Dr. Hamburg, the ability, this second wave that is now hitting Europe, and I assume we're seeing the beginnings of it here in the United States, this second wave, the amelioration of it will best be handled by a vaccine sooner rather than later.
Well, that's correct, but I think we have to recognize that should we be so lucky as to get a vaccine, and I think we will be, and I think we'll be learning more about that in the relatively near future, it will take time for people to get vaccinated. We'll start vaccinating priority groups, those at highest risk, frontline healthcare workers and other frontline workers, the elderly, those with comorbidities who are at greater risk, and then move out to others in the population. So we're going to be having to do those public health measures like social distancing and mask wearing, washing hands, and not engaging in mass gatherings or large group parties for quite a while still. But we can start to, in a thoughtful, data-based way, begin to open things up more, and a vaccine will surely make a difference.
Do you think that the FDA's new stricter guidelines that they introduced, apparently over White House objections this week, over the introduction of the vaccine, thus implying it will be early next year, do you think that restores some of the credibility of the organization?
I hope so. The FDA is an extraordinary public health agency. It's a science-based regulatory agency with a mission to promote and protect the health of the American people and beyond. And it and its career staff, including extraordinary scientists, physicians, and public health experts, are really experienced, really dedicated, and they have the utmost integrity. They want to do this right. It will be a difficult challenge to balance risks and benefits, but I have great confidence in them, and I hope the American people will too. Politicians should step out of the way and let the science go forward.
It's taking the FDA a great deal longer to approve AstraZeneca to begin their trials. You'll remember, of course, the Oxford trial, which was halted in the UK, suspended, but has been restarted in Britain, but not over here in the US. Is the FDA sort of, what do you make of it? Are they playing overly cautious? Why do you think they would be slower to get things going again?
Well, I, of course, am not on the inside or privy to inside information about this product and the safety review. But what it tells me is that the FDA, as it should, is taking a safety issue seriously. They want to examine it and they want to review it in the context of all of the experience with this product and related products, because having a vaccine that is effective is crucial. Having a vaccine that is safe is also crucial.
Doctor.
And we need to make sure that both are true, and also that the public will have confidence in the decision-making within the agency.
Right. We started talking about, at the beginning of this program, about whether it is possible for people to follow the necessary protocols to prevent coronavirus. As fatigue hits hard, and we're seeing it in Europe, and we were talking at the beginning of this program, that it really is about people just don't seem to be able to follow the strictures necessary to keep this down, particularly in Europe and now in the US. Do you fear that's the case? We just can't do it.
Well, we can do it and we must do it. That's how we're going to fight this virus. And there really we cannot rely on a magic bullet, whether a new therapy or a vaccine. It is those fundamental public health measures, hopefully augmented by biomedicine and new
Yep.
medical tools. But yes, we have to keep at it. The fundamentals apply. It doesn't mean that we can't go out of the house, but it means when you go out of the house, practice social distancing and wear a mask. It means we have to have systems for testing. And here in the U.S., I hope and trust that our systems are getting stronger and that we are having new, better diagnostics as well. But systems for testing done properly and married to the necessary public health interventions of isolation, contact tracing, and quarantine can also help to tamp this down.
Doctor, very grateful to have you on the program tonight. I appreciate it. Thank you.